viewers were warned to turn away last night if they were squeamish, but the surgeon said when you show them pictures, you get their attention very quickly. It was, Barry Peterson reports, a medical and television first.
It looked like Hollywood make-believe, lights, camera, action, even a genial host to help us along.
Good evening in the studio. Can you hear us all right?
Loud and clear.
It was live primetime television, complete with color commentators, but primetime television with heart, a real heart.
I'm Rick Daly, KAET science editor and your host for The Operation. With me in our Arizona State University studio is Dr. Sam Kynard, a cardiologist and director of the Cardiac Catheterization Lab at the St. Joseph's Hospital and Medical Center in Phoenix, Arizona. The patient is Mr. Bernard Schuler. We shall return to the specifics of his case after Dr. Edward B. Dietrich, medical director of the Arizona Heart Institute, introduces the surgical team at the St. Joseph's Hospital and Medical Center operating theater. Dr. Dietrich?
Good evening in the studio. Can you hear us all right?
Loud and clear.
Tonight we look at the efforts to stop the shipments across the U.S. borders. Charlene Hunter-Gault has the story. Charlene?
Our next report comes from Arizona and correspondent Rick Daly of public station KAET in Phoenix.
In southern Arizona, federal narcotics agents are taking to the air in their war against drug smugglers. The frontline weapon is a sophisticated airplane called the P-3. The mission of the P-3 is to detect and confirm illegal penetration of American airspace. On board the P-3 is the same state-of-the-art radar carried by Air Force F-15 fighter jets. The Customs Service will publicly say that such radar can spot a single-engine plane flying near treetop level at least 50 miles away, although the true capability is probably twice that. The P-3 is also equipped with infrared television optics. Arizona shares a 360-mile border with Mexico. There is virtually no systematic radar coverage of that border. And with only 2 P-3 surveillance aircraft available to the U.S. Customs Service, many of the air lanes across that border remain relatively insecure.
Good evening, good evening, good evening, good evening. Michael Grant is away tonight. I'm Rick Daly. Welcome to Horizon. Does Mountain Bell need a $69 million rate increase? Or is the company already overcharging customers by $23 million?
Halley's Comet is much like a celestial fossil, a remnant from the infant solar system, a key to the distant past. The study of comets could ultimately tell us where we came from, and the international cooperative spirit with which such studies might be conducted could also tell us where we ought to be going. I'm Rick Daly. Thank you for watching.
Don't be afraid, Mrs. Cunningham.
The year is 1948. Olivia de Havilland delivers an award-winning performance as a psychiatric patient who receives a treatment barely 10 years old, electroshock therapy. More correctly, electroconvulsive therapy, ECT. The image was to remain in the public's mind for decades to come.
The public image is engendered largely by popular press, by popular descriptions and repeated statements that electroconvulsive therapy or convulsive therapy is a bizarre, antediluvian, primitive, intrusive, aggressive, destructive, brain-damaging, brain-altering treatment. It's none of those. It is neither intrusive, nor brain-damaging, nor brain-altering, nor anything else. It's a treatment exactly the same as drug therapy for depression. We don't know how that works. We don't know how electroconvulsive therapy works.
Okay, that was a stimulus.
In principle, ECT involves nothing more than inducing an epileptic seizure in an individual.
An epileptic type event in the brain is the hallmark, the sign that certain biochemical events have occurred, and those biochemical events are the therapeutic events.
Following modern technique, the ECT patient is put to sleep with fast-acting anesthesia and receives 100% oxygen during the procedure. A substance similar to curare is administered that temporarily paralyzes the muscles. The effect lasts only a few minutes, but during that time, the seizure occurs nowhere but deep in the brain. Testing for muscular contraction will show when the paralysis is complete.
And now it's almost gone. Okay? Now we think that she is ready for the treatment.
Breathing.
Okay. And now you can see the seizure is in the foot, and you can feel the difference between the two. This one is tight. That's the only place that you can see the seizure. You can also hear it in the heart rate. And she's still in a seizure, and this is now, the usual length is about 30 to 35 seconds, and it should stop momentarily. Now it just stopped. This is the recovery period, and during this recovery period, the anesthesiologist is breathing for her with pure oxygen.
It's an amazingly safe procedure when you consider how much it's been done and how it's been done all over the world. And yet, it has, as you know, a very bad press, and even among physicians and among certain ex-patients, it is criticized.
We now render the patient unconscious, we relax the patient's muscles, and we give the patient oxygen. Well, actually, that new treatment was already killing patients in 1957.
One always comes down to this argument, but don't patients die? And the answer is no.
I believe what the original promoters of the therapy said, that it damages the brain, and that it is the damage to the brain that produces the so-called good effect.
Brain damage is an old theory. And there are some people today who believe that that old theory is still useful. That may be. I think that we have gone far beyond it, because we have been able to show that patients don't have brain damage during the course or after the course of treatment if these protections are given to the patient.
Subjects up for discussion will include State Superintendent of Public Instruction Carolyn Warner's apparent decision to run for governor. Also, former Representative John Conlon's announcement that he will run for the District 4 congressional seat, being vacated by the retirement of Eldon Rudd. We'll also review last evening's decision by the Phoenix City Council to delay their vote on the proposed land swap between Gosnell Development and the Phoenix Mountain Preserves. Thanks for joining us tonight. I'm Rick Dolly. Good night, good night, good night, good night.